Over about the last 3 or 4 days, what we've seen is an uptick in influenza, both influenza A and influenza B. I would say that started over the weekend, but then here at Dell Children's, we saw a marked increase in flu cases Monday into Tuesday morning, and then again Tuesday into this morning. Children are coming in with fever, runny noses, and cough. The majority of them are well. What we're doing for those kids is sort of controlling the symptoms, and by that, making sure they get plenty of fluids, controlling their fever with acetaminophen or Tylenol, and then if you're greater than 6 months, you can also use ibuprofen, which is Motrin.
Okay.
Yeah.
Now, I know you didn't want me to use the word alarming. This is sort of typical for the start of the flu season.
Yeah, this is typical. This increase to the degree that we've seen it over this amount of time is a little atypical. And I would say, there's been a marked increase from, Sunday into this morning. The one thing I wanted to try to convey to parents was that if it's just a fever and your child has some runny nose, a little cough, it's completely fine to call your primary care provider or treat the symptoms and see what happens. I would never tell a parent not to come to the emergency room if they're worried about their kid or they think the child isn't acting right, taking fluids, not behaving normally. In that case, by all means, come, let us check the kid out, make sure everything's okay. But I just want to reassure people that if it's a little bit of fever, a little bit of runny nose, it's completely fine to talk to your regular doctor about that. Or wait a day or two and see how those symptoms progress.
Is there a lot of confusion between a cold and flu symptoms?
I would say most people use those interchangeably. So flu is caused by influenza. Cold, it's a grab bag of sort of everything else, including influenza. So people will say, I have a cold, and if it's someone my age, it may just be a little bit of runny nose and fever that I have with any of the viruses, be it influenza, rhinovirus, adenovirus. Kids, since they're seeing these viruses for the first time, tend to have more pronounced symptoms, and that's why some of those first cases of the flu that kids see, they'll have more cough, more runny nose, fever that needs to be treated with Tylenol, Motrin.
As far as when to get your children vaccinated, how early and how often?
Sure, so we're still in November, so if it's still, even though we're seeing this uptick in cases, I'm never going to say not to get that flu vaccine. I think right now is a great time to get it if your kid isn't sick, because if we're this busy, it's probably going to get busier, or we're going to see more cases of it. So now is a good time to protect your child with the flu vaccine. And I would say that to adults, and then particularly anybody over the age of 60. That's another high-risk population that really benefits from the flu vaccine. And even if they get the flu and have had the vaccine, they're less likely to have a complication from influenza.
Is there any, areas, activities maybe parents should avoid if, they're hearing news of flu, ramping up? Maybe they should stay away from certain places like the airport or
No, I think more it's just a hygiene issue. So if you're at places like that, everybody has to go shopping. But if you go to one of these big busy stores, then take a moment and wipe down the shopping cart, with some of the wipes that they have there at the entrance. The same thing goes, you'd mentioned the airport, but if somebody's there, just make sure you're washing your hands before you touch things. If you have, it's very common now for people to carry around their own hand sanitizer. I keep some on my stethoscope, and using that intermittently helps decrease the risk that you're going to pick that up somewhere.
Okay. Is there any advice, for new parents? This is their first time with a kid, and I'm sure they worry about things like the flu. Any advice to them? Tips?
I think it gets back to some of the hygiene, but then taking it sort of one ring of protection higher than that. So it would be the same hygiene things we just talked about, but telling people who want to come and see that child, if they have any fever, cough, congestion, maybe they wait until those symptoms are gone so they're not potentially bringing it to that kid.
I do want to reference there are signs here, that go into what you just said. If you don't mind repeating some, if you are knowledgeable about them, what the signs say here.
Yeah, so in an event, what we worry about is someone coming here, say for something unrelated to flu, but because we're seeing so many flu kids, there's the potential of contracting it. So when people come here, we have some signage outside that talks about the hygiene, hand washing part, but then also if they have fever, cough, runny nose, we'll put a mask on them at triage, and that helps prevent them from accidentally spreading that to other kids.
Great. I can't think of anything else. Is there something important maybe you'd like to say just about the season? Or
No, one of the things we touched on a few minutes ago is the timing of the vaccine. So even though we've seen an uptick now, some people take that as, oh, it's too late for me to get the vaccine, either for myself or for my kid. And I would say that's far from the truth. Now would be a good opportunity to get that before we get so far in the season that you can't help but get the flu because so many people have it.